Thank you, sir. Good evening, all of you. In the next about 8 to 10 minutes, I'll be talking about, in general, about innovative diagnostics and radiology, which are improving the life of the radiologists, the medical fraternity, as well as the patients. Now, innovation per se means something new or differently introduced, or it could be something very original, very new, and important in whatever field that breaks into or obtains a foothold in a market or a society. And it could mean development of better products, better processes, improve the services, introduce new technologies, or development of new ideas. Now, there are basically two types of innovation. It could be manufacturer-driven innovation, what the manufacturer gives to us, or what is becoming more important of late is the end-user innovation. There's a product, how the end-user makes innovation, like in these pictures. Now, if you see the top medical innovations as detailed by the Cleveland Clinic of 2012, out of the top 10 innovations, 4 are related to radiology. And that underlines the fact that diagnostics are playing a major role in day-to-day practice of clinical medicine. The first of these is an interventional technique of 2012. This is the 2012, a catheter-based renal denervation to control resistant hypertension. The second was CT scans for early detection of lung cancer, the role of how screening CT has changed the diagnosis and early diagnosis of lung cancer in patients at increased risk. Number 4 is medical apps for mobile devices. Now, almost all of us use smartphones, and inherent to our daily practice are the apps which we use. And the number 6 is the implantable device to treat complex brain aneurysms, which are more than 2 to 2.4 centimeters. That is 2012. Coming to 2013, the two innovations which are there in the top 10. Number 8 is the modular device for treating complex aneurysms of the abdominal aorta. And at number 9 is breast tomosynthesis, which is increasingly coming into play into clinical practice of breast medicine to detect early cancer for screening. Now, vis-a-vis the innovations in radiology, they could be related to hardware developments, they could be due to innovations in personal, how you utilize the personal, or how productive, more productive we become, issues related to patient safety, or point-of-care diagnostics, how innovative we become to take these to the community or the outreach areas. Innovations in workflow, how we do our daily practice in the department and how well we deliver these products to the end user. And innovations, finally, in radiology education. Now, the innovations in hardware will be dealt with my colleagues. I'll leave it at that. One example I'd show is an ultrasound transducer which is coupled to a smartphone. This is already in place in the US. There's a smartphone and there's a small transducer which can be connected to a smartphone, and it can be taken to the field or in the emergency setting, whatever it might be. Now, innovations in radiation safety. We want the current generation of CT scanners have also introduced an element of over-utilization, coming with an increased risk of more radiation than the simple X-rays what we were using before, or the simple single slice scanners what we were using before. So one such innovation is use of bismuth breast shields. When you're doing CT of the chest in young females, you want to protect the breast because they're very radiosensitive, and repeated scans could induce a radiation-induced malignancy in them. And this is one innovation which has been used to reduce the radiation dose to the breast. Now, innovations in staff safety are also of paramount importance, and all those working in the cath labs wear lead aprons, and which of them can be very heavy, 10 to 12 kilos, and if you're doing a long procedure, they could really break your back. And one innovation in that is the introduction of a zero-gravity lead apron, which is hung from the ceiling, and the person doing the procedure will not have feel any weight of it. This is hung from the ceiling, and he can come easily out and in out of the ceiling hung lead apron. Innovations in radiation safety also mean you develop good protocols, utilizing various associations and experts in the field. So two such very successful campaigns which have been developed and of late include the Image Gently campaign for radiation safety in pediatric imaging, and the Image Wisely campaign which deals with radiation safety in adult medical imaging. All of them are sponsored by the American College of Radiology and other leading radiology associations in the US and worldwide. Innovations in outreach, point of care technologies, where how you go into the community where you don't have sophisticated machines. So now we have systems, the ambulances, where digital X-ray facilities are in place. So this facility could go to the village or to the trauma center on the highway and be able to do radiographs and then be able to transmit them via internet to the base so that a quick diagnosis can be made. Another very innovation in ultrasound is a ultrasound machine which looks like similar to a stethoscope developed by GE, and it's available in India, and it can be done rapidly at the bedside or at the trauma care center to rapidly diagnose internal injuries, especially in the abdomen. Now, mobile CT and MRI are not yet available in India, but they're popular in UK, where due to the long waiting list, these privately owned companies go to the hospitals, park them outside in the parking lots, the patients go there and get their scans done. Now, innovations in workflow is a very significant enhancement in delivery of radiology in healthcare. Teleradiology has made life much simpler, much easier to both the radiologists, to the clinicians, and to the patient as well. I think this will be dealt by Dr. Harsha. I'll leave it at that. Now, innovations in workflow in the radiology department, voice recognition, medical transcription, utilization of the RIS and integrating with the HIS have significantly made a real impact. Now, handheld devices, it's, as I've said, they're ubiquitously used, and most of the images can be viewed in a handheld, be it an iPhone or an iPad or a similar Android device, and these are increasingly being approved by both the FDA and other regulatory authorities. So this is one iPhone related app which has been cleared by FDA a couple of years ago, which can see the CT and MR or other nuclear medicine images. Now, there are also innovations in how patients view their images. Now, this is the era of cloud computing, where everything is stored on the cloud, and patients' images are also shared on the, they can store their images on the cloud, and they can give access to whomever they want depending upon the need. And a particular source has been the image share, which has been developed by 5 major universities in the US, where patients can log in, the images can be uploaded there, and they can give passwords and authorizations to other physicians or colleagues to view their images. There have also been innovations in how you market radiology. One such thing, though it didn't really take off in our state, is the concept of timeshare. The entrepreneur doesn't own the center or doesn't own a radiology machine, but he owns the time of a particular center. So in their free time, he gets his patients there and gets the scans done. On innovations in entrepreneurship, especially the teleradiology front, there are numerous entrepreneurs in India, especially from Bangalore. This is one such entrepreneurial site, where sitting in India, you're able to report images from the US or the Europe, which was unthinkable of a couple of years back. Innovations in entrepreneurship, again, partnering with industry, partnering with government and organizations in installing radiology equipments in a private-public partnerships. Innovations in philanthropy. We have public-private partnerships as this, which is there at PGI Chandigarh. Collaborative project with Rite Aid, Philips Healthcare and PGI, where a digital mammography is installed in this machine in addition to digital radiography and ultrasound, and this goes to the community and does a mass screening program for cancer of the breast. Innovations in equipment service. Previously, if an equipment was broken, especially in the districts, it used to take quite a lot of time for the service engineer to go to the on-site do the surveys, find out what's happening, and then report it back. So now most companies offer a remote diagnostics. The machine is linked via an internet to the base center in their head office, and a continuous diagnostics is made, assessment of the machine performance is made, and you could prevent failures or breakdowns using remote diagnostics. Now, innovations and expanding applications. Now, all through have been only imaging the living. Now, radiology is also going on into imaging the dead. It's probably will play a major role in imaging of the dead bodies in forensic applications. You want to look for internal hemorrhage, you want to look for fractures or inaccessible areas where everything can be detected on an autopsy. So this is going to play a role. And postmortem radiology has developed over the last decade. There are some institutes utilizing this technology, especially in Switzerland and other European countries, where MDCT or MRI are being put into use to look inside the body. So this is one example. A chest radiograph shows there's a postmortem chest radiograph after a firearm injury, showing the multiple bullet fragments embedded here. And on the right, this is axial CT section of the patient who died of sand asphyxiation. You could find the aspirated sand in the tracheobronchial tree and the result in pulmonary edema. Now, innovations in creating awareness predominantly to the patients and to the lay people. So the International Day of Radiology is being celebrated. As Dr. Abkari was saying, November 8, 1895 was the day when X-rays were discovered. And this is being celebrated from last year, from 2012, as the International Day of Radiology, to promote awareness to the people as well as a networking with all the radiologists. And 2013 has been designated as the year of ultrasound by the American Institute of Ultrasound and Medicine, again to integrate ultrasound education for both clinical applications and education. Now, innovations in supporting tests. Now, those of you who know that a computer tomography might require use of contrast, and that before you give contrast, you need to test the renal function. So for renal function assessment, a routine serum creatinine blood test could take 2 to 3 hours in the routine laboratory. But something you have like a glucometer-like device, where it's a strip-based device, you could do the serum creatinine at the CT scan itself, a point-of-care diagnostic again. So these are the innovations which can be there in the diagnostic setup as well. And finally, innovations in radiology education. And I think this has made a significant impact in developing programs for radiology residents. Nowadays, most radiology residents are online than they are in the real world. So you have cloud-based multimedia radiology education, which is a reality. You have websites, so many. You have webinars. You got the YouTube, the TED-Med, mobile devices which support all these devices. So that's become a reality again. So to conclude, the innovations are in multiple spheres, and you need to really think out of the box to be able to utilize the advances and make radiology a fruitful and a safe field for patients as well as the doctors. I thank all my co-panelists for having readily agreed, and finally to eHealth for having us here, and all the participants in this conference for having patient hearing. Thank you very much.